Your reporting continues now here on The Week in Prime, Newsroom Africa, Channel 405, with the conversation on this 2019 World AIDS Day. The call to action is recognizing the power of community in spite, of course, of the various challenges that we face in the country. Now, according to the recent report by the United Nations, more than 7 million people in South Africa are living with the virus. The UN's General Assembly is calling on countries across the world to ensure that at least 90% of the people living with AIDS receive comprehensive prevention services by next year. For more on this, we are joined now in the studio by Dr. Abdullah, former CEO of the South African National AIDS Council, and Nkhatho, a professional nurse. Good evening, and thank you both for coming through.
Good evening.
Doc, I'll start with you. I mean, let's talk about what the Deputy President was saying today. I mean, when you hear the Deputy President saying community action remains an important pillar in making a change happen, also in shaping policy as well as the outcomes. I mean, what comes to your mind?
Well, there are two challenges, right? One is to put people on treatment, and there are some people say 5 million people on antiretroviral treatment. That's a huge enterprise, not only by the government, but also by communities, you know. These clinics are in communities. Patients are taking pills in communities with families, and there needs to be a great interest in that. At the same time, we have a few 100,000 new infections, and that has to do with changing behavior, dealing with the issue of gender-based violence, like you reported on earlier, but basically for a community to start acting at multiple levels to reduce these new infections. So both on the front of treatment, but also on the front of preventing new infections. Unless we have a wide-ranging response from communities, from churches, from families, you know, we're going to continually struggle to overcome this epidemic.
Yeah, 2016, 270,000 new infections. Now, 222,000 new infections. It's still very much high, that number of new infections. What do you think are the contributing factors, being a professional nurse working in our communities?
I think the first thing, we need to realize that HIV is a transformative issue, is a challenge which needs transformation, and it's a social issue. So we need to deal with the structural drivers. Yes, we have good policies, but policies don't talk, don't do the work. So we need to take this to the communities and translate these policies into action. And communities are not only townships, also at institutions of higher learning, at schools, there are communities within those places.
Yeah. What are those structural defects in our communities that we need to dismantle? I mean, one would, for example, look at whether or not are we continuing to have those frank conversations that we used to have. I mean, earlier on, around 2010 or so, it seems that momentum has now subsided.
Definitely. Yesterday, I was having a conversation with people who are in the profession, and we were talking about a simple thing, sex. And people shrink when you mention the word. This is a professionalness, and the question is, how do I start a conversation with my child with regard to sex? Yet I'm equipped enough. I'm a professional person. But so now what about somebody who doesn't even have the information? So the question is, how do we use the very technology we have? I mean, right now, as we are having a conversation, it should open the door for families, whoever is watching, to actually start the conversation. So we need to demystify sex, because that is how most of the infections are happening. And yes, bringing conversation into homes, into communities, and having frank discussions.
Yeah. Dr. Farid, especially coming from your previous job at the South African National AIDS Council, does it worry you this issue of funding actually being reduced now around HIV and AIDS programs. Previously the conversation is about maybe the thinking is that, well, we've won the war, especially if you look at the stats coming from ESHO, where they've far exceeded the 1990 target, and you're thinking, oh, maybe we are doing well. Does it bother you at all? But also with regards to its impact on advocacy work that is done by NGO?
Yeah, Thabo, I think you're spot on. We have, government and the donors have focused their funding on treatment, and that's excellent. But there's still another 2 million people to put on treatment, so all the loose cash, the additional funding is going to treatment. But, we really need to dig deep and find additional resources for the prevention programs. So you're spot on about that. And there are new prevention tools coming on stream now. For instance, there is now a prevention pill. And in South Africa, we are way behind many developed countries, but even some countries in Africa, like Kenya, where we're not providing sufficient resources for the prevention pill. We rely heavily only on donor programs for that. But at the Medical Research Council, where I now work, we have injectable prevention mechanisms coming up. We're trialing a vaccine. These are things that are going to need investments in prevention, and we can't treat our way out of this epidemic. And I'll disagree with so many people who've been talking about this 90-90-90. I think it's a great target for treatment. But if we think that reaching those targets is going to snuff out the epidemic, the logic is that if there are enough people on treatment, then people will not transmit to other people.
Yeah.
But that theory has been blown out of the water by the scientists for a year or two now. So, treatment is not going to lead to prevention.
Yeah.
We actually need to tackle prevention in and of itself.
And what approach should we take to prevention? Because, as you say, it does seem like the first 90 of getting tested is probably the easiest to reach. In fact, most districts in South Africa have been able to reach that. But it's the two other 90s that are still a major challenge.
Yeah, that's true. That's Thabo, you've done your homework here, right? All the surveys we have now show that probably 80 to 85% of South Africans have tested for HIV and they know their status. But, hundreds of thousands of those are not taking the next step to treatment. In particular, young men, young children, and then people at high risk, certain communities. So there are challenges with getting people onto treatment. And once people get onto treatment, most of them do really well.
Yeah.
So it's that middle 90 that, you've put your finger on, spot on it. And that has to do with the strength of our health system.
That's right.
It's not just that men don't want to go for treatment. Of course, we have that problem. We all know it.
Yeah.
It's like men are just so stubborn, They have like a virus. They won't do anything about it.
Yeah.
That's going to take years, if not generations, to change. But our health system could be a little more inviting, right?
Yeah.
We could have Saturday clinics.
It could be a little bit more inviting. 4 million men this year reported to have gone for voluntary male medical circumcision. That's something that should be applauded, because as they do that, they also get tested for HIV. So it seems somewhat there is a program that has been done that allows them to come in and they're a little bit more comfortable in accessing the healthcare system.
Yes, that is true. And I always say, working with young people, we have to meet people where they are. We shouldn't expect people to come to us. As a simple example, whenever we have campaigns, you wouldn't find lots of males there. But immediately you do the same campaign on social media, you get a good response from men. It's not like they are not interested. The question is, are we speaking the language that they can understand?
Yeah.
And are we opening safe spaces for them to be able to actually come up and open up about their challenges?
Watching some of the inserts that we have been playing, in fact, one of the patients saying, sometimes I feel when I access this particular clinic, there's discrimination there, and therefore I need to move and go to another clinic. I mean, what needs to be done for us to deal with that? Because part of the targets for 2030 is zero discrimination.
Mm-hmm. Safe spaces is the way to go. If I say to people, we are running this service, we are providing these services, from the first point of entry, administration, how cumbersome is it? How open are the people that are welcoming people at the desk, the service, at the reception? And then before you even get to the nurse, do I feel safe? Do I feel welcome? And young people know what they want. They are very open and frank about what they want. And if they don't get it, they walk away. Yeah. They are not apologetic like us. They are not willing to accept a service that is substandard. So we have to change ourselves.
Dr. Farid, evaluating the numbers and looking particularly on this issue of new infections, have we established if there is a link between the new infections in terms of the data that is captured and gender-based violence?
Mm-hmm. Yeah, it's quite a difficult link to establish on one level because a lot of the gender-based violence is not reported and you can't measure it properly. On the other hand, I don't think you'll find anyone who works in HIV who will tell you otherwise. Gender-based violence is a critical driver for these new infections. So we have a rather toxic arrangement here in South Africa in particular, where there are high levels of gender-based violence. If you look at young women unemployment, it's well over 60%. Yeah. Poverty in this group is most extreme. Powerlessness, this is all things coming together. In addition, we have developed certain cultural practices in this country. So younger women tend to have relationships with men who are 8 to 10 years older. This age-disparate relationship has been shown to be a major driver of the new infections. The older men have had more time to accumulate HIV, yeah. and then they transmit it to the younger women. Yeah. So these are all the factors. I think we have quite a good understanding about that, and then we're seeing all these sort of new, modern, for lack of a better word, ways of sexual relations. We see the blesser phenomenon, yeah. which accounts for a portion of the transition. We have a large sex work industry in this country, yeah. with more than 150,000 sex workers. Then you hear of things like Stockfells for sex, yeah. All those sorts of things. But the main thing is gender-based violence.
Yeah, a number of contributing factors that would require various new interventions and new solutions to it. Let me thank you both for coming. I do appreciate your time.
Thank you very much.
Dr. Abdullah and Nkhatho there helping us through that conversation. Let's take a break. Your reporting continues after this.